Welcome to the office.
Phil, how you doing?
Could be better. Could be better.
Welcome to the office.
Yeah, thank you.
Why are you here?
In 2012, end of 2012 and 2013, or beginning 2013, we found a tumor in my spine in the L3, L2, L3.
L2 and L3?
That's what they kind of did, put L2/L3. So
Okay.
it kind of was around.
It was in the bone, or it was in the disc, or it was all around it?
It was around it, and then it.
Did they tell you the type? Just curious.
Non-seminoma, something, but they just told me that was just
sarcoma, blastoma. Do you remember any of those terms?
Both sounds familiar.
Okay, so maybe you can get me that paperwork later.
Yeah. Oh, actually, I brought the medical records. Yeah, I can get it in the car.
Okay, so, no problem.
Yeah.
So that was in 2000.
End of 2012.
2012, diagnosed with, or they found. But why did you go to the doctor? What led to it?
I couldn't. One night, I couldn't bend upwards at all. It just all of a sudden I just kind of stiffened up, and my cousin had to carry me over his shoulder to put me in the car to take me to the ER.
Oh wow!
I couldn't move it, and so that's when we found out that we had stage 4 cancer. They said that there was a tumor around it, and it grew inwards as well, and it crushed the L3, L2, one of those two, and then they did a kyphoplasty a couple days later.
Okay.
And then they found that it was.
Did you go through radiation as well?
No, it was just
chemo.
chemotherapy.
So you had just chemo. You had the surgery, and then you had chemo.
Yes.
Okay, and that was in 2012.
And 13.
And 13,
Yeah.
And then after that, you obviously get checked every year, 2 years.
Yes, my oncologist. Yeah.
And your markers are all down.
Good.
All good, right?
Yeah, remission. Yeah.
Okay, so you're in remission from the L3.
Correct.
Okay, then what happened?
And then they did an orchiectomy of my right testy, and ever since then it's kind of been pain.
I just want to say one thing, if you don't mind.
Sure.
Okay, this, guys, when we're sharing stories here, and especially here in my office, as you've watched on YouTube and other social media platforms, we're sharing real cases here, and you have to give them a lot of props for sharing. He's sharing a lot of intimate information about himself, and when I see guys leaving weird comments and stuff, I just kick them off the channel, dude, because this is real people, real issues. And where are you coming? You're coming from Vegas.
Vegas.
You drove from Vegas.
Right.
And it's a big deal. I'm sure you've had some care out there. I'm sure you've seen some people, which we'll talk about.
Yeah.
And I just wanted to make a point. I appreciate you coming out. It's a big deal to be out here, but it's also a big deal to share your story, dude.
Yeah.
So I just want to say I appreciate that, okay?
Yeah.
And okay, so I have you continue now.
Yeah,
Sorry,
so
I just had to sidetrack a little.
After the orchiectomy, just kind of been pain down there, and when I bend and move a certain way, I can feel kind of a shooting pain to my groin area.
Why did they do that?
The
orchiectomy?
That's where they said the source was. It was testicular cancer.
Oh, it was testicular that metastasized to the bone.
Yeah.
Okay. Have they checked your lungs, digestion, all that's good?
Yeah. So they did. Since it was stage 4, we realized that it spread to my lung, liver, my right leg, and my neck. So we did it chemotherapy right away.
Okay.
And then.
How long were you doing it for, if you don't mind me asking?
It was, I would think, the harsh one, the 6 cycles.
Okay.
It was VIP. I forgot what the name of the chemotherapy was.
That's okay. Yeah.
But yeah, it was very rough, and they said that it didn't get rid of a lot of it. But then I did my own research in the hospital too, and I came across a certain diet. Like a ketogenic diet, low carb diet, and then that helped with the chemo to get rid of the cancer, and then
amazing. All right, so you've completely changed your lifestyle now.
Yeah.
Correct.
Correct.
All right.
I was not eating the best back then.
I'm sure you were enjoying. All right, so what brings you out here to LA to see me?
So for the last decade, I've been managing my own pain, kind of doing my own exercises, physical therapy, and everything, and now it's getting to a point where it's just hurting quite often.
The back.
Yeah, and the groin.
Growing and the back.
Yes.
Okay, right side, left side, both sides.
More on the right side, but lately I've been feeling some on the left side, like today.
Okay, so low back pain, growing pain, both sides.
And also goes to the hips,
Okay.
more towards the left side of
Okay.
the hip. And Yeah, around there.
Okay, what else?
The tailbone as well. Unrelated to the cancer, the jaw.
Okay.
It clicks when I open my mouth.
TMJ?
Yes.
You also have braces, though.
Yeah, that's...
So we're going to talk about that when we go over your x-rays.
Okay.
And I'll check your TMJ, but I want you to know during braces, how long are you going to have them on for still?
It's probably 7 more months.
Okay, so I could work on it on this trip, but I know as they tighten up, it may shift around.
Okay.
And the real fix won't be till after the braces are off. I just want to be clear about that, okay? Yeah, absolutely. Absolutely. Okay, so we have back, hip, growing into the thighs.
Yes.
Front and the back, or just the front?
Mainly on the back.
On the back, so more in the hams.
Yes.
More in the hams.
It kind of goes wrap around the front to the front of my knee sometimes.
To that knee?
To this knee. Yes.
How about that side?
I don't feel it much on this side. It's mainly on this side.
Okay.
Going around to my knee.
There's something we got to look at there too. Okay. All right. What else?
My thumbs. So my
You
wife
a gamer?
likes. No, my wife likes to crack my knuckles out of...
What's your wife's name?
Natalie.
Natalie, you better stop.
And just one day that when she cracked it, it just kind of been hurting since then. So.
Natalie. Okay, both sides?
Both sides, yeah.
All right. Okay. What else?
I think that's
good start.
Yeah.
But I think the main thing is this chronic low back pain you've been dealing with for a while. And what we'll do is let's go over your x-rays. Let me explain everything I see first. I'll make sure you understand the situation we're in first.
Okay.
We'll examine you. We'll figure out where you're going to start.
Sounds good.
You'll be here till Tuesday?
Yeah.
Okay, so we have a few days to kind of help you get back in balance.
Yeah, hopefully.
That's what you're here for,
yes.
right? All right, so let's get to it. Come on over. This is a picture in time. Tells us how you've evolved from birth. I want you to think of this as your 24-story building, looking at you from behind. This is the right side. In order to have a stable building, we need a level base and foundation. Okay? First thing is, and I know we're going to get to that part of it, but you can see there's that kink in there. There's the L3 where the issue was. Mm-hmm. But before even dealing with that, there was already pre-existing tailbone and foundation stuff going on. Oh. So that's what we have to focus on first. Now, if the foundation is not level and not right, then do we want to be on the 3rd, 4th floor of your building? No, we want to
fix the foundation first.
We got to fix the foundation. So let's start down at the foundation and talk about it. And the first thing we see, I'm just changing up the contrast so you can see it. We have a rotated sacrum on the right side, drop down 3 millimeters on the left. We have a rotated pelvis, and the way the pelvis is misaligned tells me it was trauma. There are old injuries that happened growing up, I'm sure. I'm sure you played fun. You had a lot of fun playing.
It was football.
We have a 5 millimeter measured difference on the left, slightly lowered leg on the left. Now, regardless of the lower leg, it's still under 7 millimeters. Adjustments will hold. 3 millimeters of it, though, is coming from the tailbone injury. So I'm hoping we can even get it up a couple millimeters for you. Okay? ASEX with a rotated sacrum. This is an AS major when we have an AS or IN or ASIN major on the side of a rotated sacrum. Book says to do the sacrum first. I would probably agree with that, but we're not starting up here. We're actually going to be down here. I want to show you. So when we go closer, and you talked about tailbone too, right?
Yes.
And there it is. So when we're looking at the sacrum, this should be a smooth arc. You had a good Coccyx S5 injury here down in the tailbone. Okay. You have an anterior misaligned Coccyx. Oh, wow. When the Coccyx misaligns anterior, and this is good information, when we're looking at the spinal cord, right? So you have the brainstem, the brainstem, spinal cord comes down. The spinal cord stops at L1. It becomes a string. Okay. Maybe we'll show a picture of that string. That string becomes the final terminale, and it ends at the tip of the Coccyx. So I want you to think of the Coccyx also as the anchor of the nervous system. Okay. So it maintains the overall tone. When it misaligns anterior, which is 90% of the time, it causes a loosening. When it misaligns posterior, it causes a tightening. Okay. You know, like the guitar string?
Yeah.
So your string is a little loose. And we want to do that first. So we have the coccyx number 1. Now you can actually see it on this x-ray, okay? The coccyx starts here. This is all coccyx, all right? And I'm going to draw a line to show you the misalignment. You see what I'm drawing through?
Oh, yeah.
Okay? And if we take that line down, you can see that's where your tailbone injury came from. Came from an old coccyx injury.
Wow.
And the message here for everybody is this, okay? We have slips, we have falls, we hurt, and sometimes what happens? We compensate, the pain stops, but the issue is still there. And it carries with us in our future. And so the body, how do I say it? Those injuries we have as kids, the body hasn't fully developed, the bones haven't fully matured, and so they mature slightly different. And it's not about being good or bad, it's just different, and it creates compensations in the body. All right? So we have the coccyx, we have the rotated sacrum on the side of the ASEX. Now there's an interesting finding here I do want to point out. When I'm looking at your transverse processes of L5, you have what's called a spatulated L5, and what I'm about to share is very important, both sides. This one wants to rub on there. Follow my process. The transverse processes, so if we look, this is the shape of it, right?
Yes.
Yours, you can see, instead of having that, it has that spatulated appearance. It's bigger than normal. When it's like that, you can see that one, right?
Yeah.
You can see that's long, but that's too thick. It should be like this. Okay. That's just the way the body formed. It's okay. But the point I'm making, you want to maintain the mobility. We will need to work on L5 at some point, and I'll explain why. But we don't want those touching because those ligaments have shortened and we don't want them to calcify. Otherwise, we're stiff and you're walking like the cowboy.
Oh, I don't want that.
Okay? So we want to make sure you have good mobility in your SI joints and you have good flexibility in your lumbar spine. Okay? Make sense?
Yes.
All right. Now, let's continue up. From there, now here's the interesting part, but we already know why. The spine will usually curve to the low leg. Yours went to the opposite side, right?
Yeah.
But we know that we had stuff here. This is L5-4. This is L3. It was your L3, L4, not L2. Okay, so whatever they did here, the idea is the body's trying to fuse these two segments together.
For more support?
Absolutely, but that's also because you have all this instability down here. So we get this right, this is going to feel different.
Oh.
This is not the cause. This is the cause.
That's crazy.
Yes.
Been trying to fix the wrong thing the whole time.
You've been going at it, and that's what happens. People chasing pain, chasing result, not cause. Okay? All right, let's continue up. Make sense so far?
Yes, yes.
All right, so we curve this way, we come up, and then we get up top here. These are just mild deviations. I'm not too concerned about that, except for this T2, T3 area. T2 has a hard side slip to the left, and that's what's throwing the neck off. T2 has a lateral shift. That was one of those hits that came this way from right to left side. So we have a T2 potential as well. We get up top here, the upper cervical is looking pretty good, dude. I'm okay with that. Upper cervical looks decent. This one may be a tiny bit swollen compared to that, but it's okay. Deviated septum. Any breathing issues out of your right nostril?
I wouldn't say issues, but it's kind of.
Do you notice it gets clogged on the right side more than the left? Yeah. And if you want me to deal with that while you're here, I'll deal with it.
Yeah, let's do it.
All right, man. Now, jaw. Hat.
Oh, man.
When we're measuring the jaw, the clicking side is usually not the cause. The clicking side is usually the compensation. And which side did you say clicks?
Left.
Okay. You sure?
I don't know, it feels like I'm here both.
So what I see based on the measurement that the right is compensating, but it looks a little interesting because it looks like the right deviates out first and compensates. He may have a double subluxated or a double compensated TMJ. We'll check when we do the exam, okay? So we have TMJ, we have T2 major on this x-ray that I see as a side slip. We have the rotated sacrum, we have the tailbone, and we have the pelvis. Now we go to the side profile. on the side profile, and there is a lot of good news here too, I give you at the end, okay?
All right.
Yeah, I got you, dude, don't worry. All right, let's look at the overall appearance now. So ideally, what do we want to see? We would like to see a forward curve in the neck, normal. Yours actually goes in reverse. Oh. We would like to see a forward curve in the neck, 40 to 60 degrees, 60 in the mid-back, 60 in the low back. So you have no curve. You got almost that poker spine going on. Now, where does the loss of curve come from? It comes from the AS component of the misalignment or the IN. AS-IN causes the AS or IN causes the straightening of the spine. The process it goes through, it's called nutation and counternutation, okay? And so when you're looking at the motion of the sacral or the sacroiliac joint, when the pelvis misaligns anterior superior, it causes the tailbone or the base of the sacrum to go back. Oh. That causes the straightening of the spine. Long term I'm talking about. Okay. When the pelvis misaligns PI, the base goes forward. Okay. That forward creates more curve. So the fact, and now his case is actually a little more complicated because that would usually tell us which pelvis to work on. Straight spine, we would think AS, but it could also be the IN causing it. Yeah. I don't know till I examine you. Gotcha. Okay. My suspicion, it's the right side. That's my suspicion because we have the rotated sacrum on the side of the rotated pelvis, according to the book. Okay. Okay?
We just got to fix this foundation.
Foundation we fix, and then we move on, dude. Yeah. All right. So next is your posture line. When we're running a posture line from the lowest lumbar here, we're going to run it straight up. And this is going to be another key thing we need to work on, or you will need to work on. The upper part of your building sits behind your foundation. And because of that, your muscles in the shoulder and neck are actually working overtime. Okay. So I know this gets tight. You get stiff and tight when you're sitting a long time or you're standing a long time. So the idea is get the foundation right, start to get a little curve in that back, and get that body forward. Okay. And the challenge is going to be, it's L4 that's causing that forward, but that's going to be the fun part when we get to it.
Gotcha.
No pun intended. Okay? All right. Now, the good news is this. Your discs overall are still good, okay? Some are less, but overall decent. 5 is tilted back, 4 is tilted a lot, but the discs are fine. This we know is less, okay, for whatever. These two are trying to fuse. We let them. Okay. I'm not worrying about that. There's not a surgery thing. Your hole is there. The nerve is coming out fine. You may have stiffness, but as I said, you need mobility work. More mobility included in your strength training.
Got it.
Got it?
Got it.
Let's continue. These discs are all good, good, good. Now, 2, 3, 4, 5, 6, 7. C7 is what's starting this reverse curve. So 7 tilts back. Because of the sway back and reverse curve, you can see the bone is thicker there because all the weight is being put on the base of your neck here. C7 tilts back, 6 goes more with it, 5 goes with it, and then 5 starts the reverse curve. So for you sleeping on your back, ideally with no pillow is best. 2 pillows under your knees.
I do notice without pillow feels more comfortable.
Yeah, because if you use pillow, you're forcing it forward, right? Okay, so you got all that part, and we'll have homework for you while you're here, okay? Great. Make sense?
It does.
Questions?
Not yet.
Ready to get started?
Let's do it.
Let's do it, dude. All right. Let's start at the base of the neck. And the first thing we're getting is C7, 5 points, left side hiding out. C1, left side, 5 points. T2, these are old ones hiding out, dude. T2, right side. T6, right side, that's your digestion area, which we know your digestion is also off. Let's see. S5 coccyx, right side. S5 coccyx, right side. T2, T6. C1 washed out. Base of the neck is still there. Okay. Scoot forward a little bit, please. Let's do some general motion palp of the SI joints. Feet touching together. Open and close your knees with your feet touching. Want to make sure we get... What we're doing here is just checking general SI joint mobility. Do the right side only. When we do the right, keep going. The whole left shifts with it from fixation. Do the left side. When he does the left, the right side is also moving. Do that again, please. Okay, when he does the left, the right moves. All of this moves together. Do the right side. I actually take that back. The left side is moving fine. It's getting stuck up here around L2, L3. Scoot back for me, please. Let's check motion again. Top of the joint, middle of the joint, bottom of the joint. More tender there on the middle or the top? More in the middle or the bottom?
Middle.
Middle. Okay, let's do the left side just to compare. Top of the joint, middle of the joint. That's actually moving. That doesn't hurt like the right side.
No, it doesn't hurt.
Now let's check the tailbone. Sit straight for me, please. Come back slowly. This is the one we'll need to get to. That's 5. Sorry, that's 5. Tender?
Tender, yeah.
1. Tender?
Yes.
2.
Still tender.
3.
Really tender.
4.
Not as tender.
5.
Less.
I'm on the outside now. That's where I need to start. On the right. See, I bend to the left, it's okay. I bend to the right. That's where it is,
yeah.
Right there. Coccyx, S3. Coccyx, S3. Let's check static palpation. Head down, please. Static, you can see the swelling, edema, point tenderness, pulls right there. 1, 2, 3, 4, 5, 6. That's 7. That's 6. 6 sharper for you or 7?
7.
That's the sugar button. That's 8. 7.
7 still.
You can see the pitting edema there as well, 7. Okay, and let's check the neck. 7. 7. 1. 2. It's hiding in there. You feel that when I'm pushing?
Yeah, on the
left side, right there. That one's okay. See the difference?
Yeah.
That's hiding T2. Let's check the atlas. Let me do it, sir. Nice and easy. Bend to the right, bend to the left. Okay. So there's another way to check rotation and motion of the atlas. One finger on the C2 lamina, one finger on the transverse, and we're just feeling for separation, comparing one side to the other. This is on the lamina, bottom finger, top finger is on the transverse. That side's moving. We have ASR, slight P, ASRP atlas. I'm going to wait on this, okay? ASRP atlas, T2, T7, S3, coccyx. A little bit of that pelvis also. We'll check the motion of the pelvis after. No, have a seat. Have a seat. We'll check the motion of the pelvis after. As I said, most of that pressure is coming from Coccyx S3 area.
Okay.
So we'll do that first. Okay. We'll have you walk. Then we'll do 2 and 7. Have you walk, and then we'll recheck everything.
Okay.
After we do spine and stabilize it, then I'm going to check up top on the jaw. Okay. We'll see the nose probably next visit. I don't want to mess with all that stuff at the same time.
Sure.
We got a few days.
Yeah.
Okay, stand up. Let's see you walk. Just regular walking. Keep going. So when he walks, he kind of walks on the outsides of his feet when he walks. You've been doing that for a while?
Yeah, I noticed when I ran the marathon that I was landing on
the outside. So he's in external rotation, slight supination. That's actually telling me to go for that upper cervical first.
Okay.
Keep walking, please. One more time. The right doesn't move as well as the left. Keep going, please. Okay. All right, have a seat. Let's start on the side posture. We're going to start on the coccyx here. Then we'll go there, continue S3 and coccyx as we see, and then 2 and 7.
Got it.
You ready?
Yes, do it.
Showtime. Bring this out a little bit. And go ahead and hold your wrist here. There you go. Head straight. Wifey came with you, or is she working? Relax the leg. Just let me roll you, sir, okay? Good. You're already starting to move. I'll be on your underwear, okay?
That'll be fine.
Right? And I'm going to bring it out. Relax. That's a piece. Up. There you go. Wait for it. Okay, sit up, please. Sit back over here. Right ear down. That's the home run. Gotcha. Stand up and let's have you walk it off, please. Ha! I want you to watch his feet. This is after the coccyx and atlas. Just keep walking. Awesome. Let's go face down over here. Slide up a tiny bit more. I got to bring this pelvic piece up for the coccyx. You okay there?
Yeah.
Is that okay on your third lumbar?
Yeah.
Cool. Gotcha. All right. Now we're going to do S3, slightly on the right side, torquing clockwise. Right there. You okay, sir?
Yeah.
Cool. Boo. Gotcha.
Ooh.
Nice. Yes, sir. All right. May I continue?
Yes.
1, 2, 4, 5, 6, 7. Tissue out of the way. That's the home run. That was squishy. Now, for T2 side slip, it's a left side slip. We're going to do this in 2 parts. We're going to start on the right side to get some rotation out. 1, 2. On the transverse slight. There you go. Now we go over to the spinous contact. There you go, brother. Nice. All right, Phil, let's get you up. It's good. Wait for it. All right. Let's walk it out. Now, as you're walking several times, you can tell me if anything feels any different to you.
I don't feel like I'm walking on my edge to my feet anymore as much.
A little more balance.
I feel a little lightheaded too.
Okay. Turn around, let me open the back. Let's see if you got that little vagus wiggle or not. Hips are moving a little bit better. That's good.
Yeah.
Keep going, please. What was that thing you were saying that you were having trouble with your low back? To do?
What do you mean?
You're having trouble bending?
Oh yeah, bending over.
Okay, try it out.
Oh yeah. Oh, I heard a pop.
A little different?
Yeah. Wow.
Right on, dude. Come on over, have a seat. Starting at the base. Upper cervical is clear. T2 is clear. T7 is clear. We got a little bit of heat over here to ice. There you go. Tailbone is clear. Now, most important is how it feels when I palpate it right now. You remember what it felt like, right?
Yeah.
All right, let's check it out. Booyah. Come on back. That's 5. Sorry, that's 5. That's 1. That's 2. That's 3. Different?
Yeah.
That's 4. That's 5, dude.
Whoa, it's no pain.
Bueno. Good stuff, dude.
Awesome.
You ready for more?
Awesome. Yeah, let's bring
Let's
it.
do it, dude. Shoulder. Down. Shoulder. There you go. On your back, please. Raise your right leg. Raise your left leg. Awesome. Sit up and turn. You want jaw or nose today? What's more important for you today?
I think the jaw.
I think the jaw too. Let's check it out. I think Phil's in a little awe. He didn't know what he was going to get when he came, huh?
No, I did not know.
Open slowly. Slowly close. Okay, I want you to watch. Slowly open. Right. No. Slow. Close it. Slow. Left comes out first, then the right compensates. So right is actually the compensation, left is the subluxation. We're going to do the right side first. Open all the way. Close halfway. Hold. I'm pushing right to left. There you go. Open. Close. Open. Close. Open all the way. Close half. Stop. Pushing right to left. There you go. And now we're going to deal with that left side. Open. Close. Open all the way. Slowly close. There it is. Gotcha. Ears. Let's do the machine on the TMJ, break up some of that scar tissue. Open and close the mouth should be easier.
Yeah.
Right?
Yeah.
Squeeze the hand. Squeeze. A little bit on the elbow. Relax the hand. Relax the hand.
Whoa.
Squeeze. Relax the hand. Relax the hand. There you go. Squeeze. Squeeze. Questions for today?
Is there any mobility stuff that I
Right
need
now,
to do?
just walking.
Okay.
This weekend while you're here, just walking, hiking, get as much movement as you can, okay?
Gotcha.
Ice the jaw, ice the spine, the areas that I adjusted.
Okay.
Sakina will have some homework for you.
Okay.
All right?
Sounds good. Thank you, doctor.
Welcome to the office.
Appreciate it.
You got it.